Thank you for coming today to St. Mary Development's second annual Business of Aging event. My name is Tim Beat. I'm the president of St. Mary Development. This year is actually St. Mary's 30th anniversary, and for 30 years we've been focusing on taking care of seniors, improving their quality of life, creating safe, affordable, accessible housing, and connecting those seniors to services that allow them to age in place. 30 years ago, the whole concept of social determinants of health really wasn't something that existed too much, but our co-founders, Sister Rose Wildenhouse, who is here today, and Dick McBride, always had a very holistic view of seniors, and so they not only created housing, but they also created food programs and transportation and activities and other things. So we've always been really ahead of the game in that way, and we've always had that social determinants focus. Today we provide housing for about 800 seniors in the Dayton area, as well as connecting them to services. Really dozens of different services with the same types of things: transportation, connecting them to healthcare, and helping them to navigate what are often complicated systems. And it's working well. We just did a recent economic impact study and found that over the past 5 years, St. Mary's has saved taxpayers about $38 million by keeping those seniors living independently and out of Medicaid nursing homes. Throughout our 30-year history, our success has really been dependent on the fantastic partnerships we have with other organizations. We don't do this alone. And there are so many organizations that share our passion for serving seniors. We're blessed to work with partners who help us both create the housing, deliver those services, and even bring new technology solutions into our buildings. This is the second year we worked with the Dayton Business Journal to put on this event, and so thank you to them and to Don Baker for helping us put this together. We've also been blessed with many great event sponsors, and without the sponsors, this event wouldn't be possible. And those include our silver sponsors, River Hills Bank, LCNB National Bank, and the Ohio Capital Corporation for Housing. And we have two table sponsors today: the Kettering Health Network, their Years Ahead Health Center, and Retire MedIQ. So let's give them a big round of applause. I'd also like to thank the Delmar Healthcare Fund, and Don Ambrose is here with us today. We've recently been doing some technology research to find out what are the gaps between seniors with lower incomes and higher incomes. And through their fellow program, we've been able to do some very interesting research, and we will be sharing that research, sending all of you an email to all the attendees today to kind of bring you up to speed so you can see some of the attitudes and gaps there are with technology, because St. Mary's sees that technology is going to play a big role in this housing and healthcare connection in the future. Today, moderating the event, we have two of our good friends, Bob Wolf and Gloria Shanahan. They are co-hosts of WHIO's There Is a Season radio program. It's every Saturday morning. We've been on many times. They focus on senior issues, and so we thought, what better moderators than to have two of our good friends here. So please welcome Bob and Gloria.
Thank you, Tim. Good morning. I'm Bob Wolf.
And I'm Gloria Shanahan.
And if any of you are talk radio fans and happen to listen to WHIO over the last 9 years, Saturday mornings at 9 o'clock, you would have heard that exact greeting. We just passed our 9th anniversary on the 25th of September, and we've enjoyed it, right?
Yeah, I think we've lost track a little bit, but we've done over 400 There Is a Season shows. That's 400 mornings with this guy.
Hey now.
Just saying.
So, despite being on that long, with everybody's media tastes and so forth changing from year to year, and there's a certain fragmentation in the radio audience, people still say, well, what's that show about? The There Is a Season title is obviously drawn from a biblical reference in Ecclesiastes, but we also took the song by the Byrds as part of our inspiration to talk about the different seasons of life. And we've divided our program, those 400 plus shows, into about a half dozen categories, including caregiving and relationship. That's a key part of a lot of our lives, especially at this age. We talk about lifestyle and transition, some health and wellness issues, financial, legal, and insurance issues. We also talk a lot about purpose and engagement, especially later in life, since, as you probably know, a lot of people reach a certain stage of their life when they're done with their careers, done with parenting, perhaps even done with grandparenting, and they say, well, what's left? You know, what's next? So our inspiration was to do a show about change, about aging, and at the time we pitched this to Cox Media, there was nothing like this on the radio, certainly not in this market and in many parts of the country, and we still haven't seen very many shows that are in our niche. So we're fortunate to have been on the air this long. We are a top-rated program on Saturday morning, especially with the audience 45 and up, and our market demographic reaches people in their 30s and their 90s. So we're talking to a lot of folks about change and aging and, of course, family care. Now, as we said here, we've had Tim on several times on our program, and he keeps coming back. And I don't know why. The coffee's not that great. The snacks aren't that great. But he's there, and he shows up, and he does a pretty good job with us. And he did discuss at that time social determinants of health, which was a phrase that we hadn't tossed around much and a little bit new for us. So we discussed that, and that podcast is available out on our website, thereisaseasonshow.com. Make sure you put in the show, but thereisaseasonshow.com. We've got podcasts in there by category and by date. Now, prior to today's Business of Aging event, you would have received an email that asked several questions. Today, using a live polling software, we're going to make this session interactive in several places along the way. If you haven't done so already, we encourage you to take out your cell phone and get logged into the system by sending a text to the 5-digit code that you can see on your program, on the back of your program. So this is the opposite of church where they tell you to put away your phone and turn off your ringer. We want your phones out. We don't want ringers, but we do want your phones out. Okay, so if most people have their phones out now, we're going to do our first question and have Gloria take it away.
All right, so we want to know something about you. We want to begin with the first question, which is, in what industry do you work? In what industry do you work? Okay, so it looks like in healthcare, if my vision serves me well, it's looking like, is that 27?
27, yeah.
27%.
29. Quick,
29,
read these fast.
it keeps changing.
That's pretty cool. We have another question, though, right?
Yep. So for a second question, you would have answered this earlier this week if you responded to the email about this event. And the question is, how familiar are you with the social determinants of health? How familiar are you with the social determinants of health?
And there are the answers right there.
So 34% of you said very familiar, 49% somewhat familiar, and 17% not familiar at all.
So some of you will have your mind blown by this event today due to our panel up here. And it's time to bring them in for the meat and potatoes part of this. Why don't you each introduce yourselves real quick in case anybody doesn't know who you are.
Hi, I'm Maddie Shea from Health Management Associates.
I'm Madeline Baker with St. Mary Development.
I'm Melissa Butler. I'm at the Years Ahead Health Center.
Hi, I'm Amy Regal. I'm Director of Housing at CareSource.
All right, we're going to start the first question here today with Maddie. So many in the audience have indicated some knowledge of the concept of social determinants of health. You saw the numbers up there. And certainly you can find any number of people and organizations on the internet and other places you might search that have got some definition or have taken a stab at describing what that phrase means. But Maddie, why don't we do it here? Why don't we try to get a definition, a working definition for today? What are social determinants of health, and why do they have such a huge impact on seniors?
Okay. So when we've seen the measles outbreak across the country and all the uproar about that, that's from a medical determinant, children that were not immunized. Social determinants are non-medical things that affect our health. And we all in our own families, I think, can think of all those social determinants. So thinking specifically about seniors, Loneliness and social isolation is a very, very big social determinant of health. And research shows that its impact on health is actually equivalent to smoking 15 cigarettes a day. Like, just to give you an idea, this is serious, what it does to the body. Poor nutrition can also be a really big issue for seniors when they're worried about those who are financially stressed and worried about how they're going to manage their money. So really good nutrition is one of the things to go. Seniors oftentimes have arthritis or conditions that cause pain, and this can really impact their physical activity, further exacerbating issues around social isolation if they're not getting out and don't feel good. Poor sleep. Violence is an issue for some, and stress. And why do they have an impact? They affect your physiology. They affect your inflammatory response, your heart functioning. They actually have biological impacts that affect heart disease, risk of stroke, and things that become medical issues.
Thanks for that. So you all heard how she answered. That was good. That was top quality right there. Appreciate that. And I think what we're going to find out today, too, is that there's a bit of a chicken and egg when people study this kind of thing. Social determinants of health are a number of the things that she mentioned there, and we'll hear some others today. But researchers have also found significant differences by regions within the same community, within the same area. You've got one zip code with certain social determinants of health scoring in a certain area and another one drastically different. And we're going to hear more about that as we go on. So let's get the rest of the panel involved here. Amy, Melissa, Nadeline. We'll start with you, Amy, on this. The question is, why do healthcare, insurance, and housing organizations care about social determinants of health? And how do social determinants of health impact the people you serve?
Yes. So as you said, the social determinants of health, your zip code is a greater predictor of health outcomes than your genetic code. And we know that anywhere from 70 to 90% of an individual's health outcomes are being determined by those social things that are occurring around them, their environment, more than what's happening in a doctor's office, a hospital, or even in the medications that they are taking. So this is of a great concern for us because as an insurance company, we're really focused on a triple aim: to improve the quality of care that a person receives, to improve the outcomes of that care for an individual, but then also to maintain cost. And we can take our focus and put it on any one of those, but the truth is it's a very equalized balance between the three legs of this stool, and if we stop focusing on one, it tips all of the others. So as we look at the social determinants of health, we know that we're not going to get quality outcomes with medication adherence or with a person addressing their diabetes if that person doesn't know where they're living that day, or if they don't have enough food on the table. And as we talk about individuals who are aging, this becomes especially prevalent because we know that it can act either way, that a poor condition for the social determinants of health can decrease their life longevity, or going into a well-designed senior living facility, how it can increase their age and their living longevity. So as an insurance company, we know that our members are going to be healthier and that they're going to have a greater satisfaction with their life if we look at all elements of their life, not just what's happening in a doctor's office.
Is this the kind of data that's being tracked when you consider all the different issues in social determinants of health? Are you able to index all of this based on address and condition? Is that all, is AI being used for any of that? I mean, how do you keep track of all that?
The data is out there. Unfortunately, right now, it's not all together and it's not easily accessible. There's not necessarily one place we can go to and look at health data and social data all at the same time. A lot of the social data is public data that's out there. A lot of the health data is being captured in EHRs and other type of health systems, which has taken that data leaps and bounds ahead of where it was just a few years ago. bringing that all together is really, I think, the beginning of a new frontier for the industry.
It's a good place for this whole conversation to evolve, an opportunity there. Melissa, why don't you take a stab at that question?
Well, I am an internal medicine physician. I'm working at Years Ahead Health Center. So I really appreciate this. It's a relatively new discussion about the social determinants of health because as a provider, I've known for a long time that if my patient is economically strapped, living in a poor environment, but their health outcome is going to not be ideal. I think traditionally, even at the government level and policy level, we've always focused on just access to health care as a primary driver for outcomes. But actually, as Amy mentioned, social determinants of health, such as access to healthy foods, ability to pay for medications, do the patients feel safe in their home, can they exercise? These are actually much more powerful determinants of health outcomes than just access to health care. So it doesn't matter if my patient can get in to see me if they can't get healthy food, if they cannot afford their medications, if they continue to smoke, if they don't understand their disease process. So I think that this discussion is very important. And as Amy said, I don't think that we are not fully synthesized yet in terms of moving in that, or capitalizing on it so that we can improve the health outcomes of all of our patients.
And as a physician, I would think there's quite a challenge on a patient-by-patient basis to kind of ferret all of that stuff out.
Yeah, absolutely. We see it from individual to individual. When I'm in the room with a patient and I know, I prescribe a medication that they cannot afford, or even, so many things are so expensive. A diabetic, just the test strips and the access to their glucose monitors and healthy foods and exercise, all the things that are going to improve their numbers for their diabetes. But if they can't access that, it doesn't really matter that they see me even once a month.
Right. Madeline, why don't you take a shot at this, too?
So Healthy People 2020 identifies social determinants of health as where people live, learn, work, and play. So we're talking about seniors. They're probably not enrolled in college, they're not attending school, they're not working. They're going to spend a majority of their day where? In their housing. Well, our housing, senior housing. So as a housing provider, we care about social determinants of health. First off, because our founders have always cared about those items. They understand that our seniors might have to choose. Do you pay for prescriptions or do you pay your rent? Obviously, they're going to pay for rent first, which means their health outcomes are going to be affected by that. St. Mary Development, our service coordination program, we try to help bridge that gap as a housing provider because we recognize that we want to provide people with a home that can afford an expensive private pay retirement community, a place to live out their years. And that's going to take some help, whether it's helping coordinate transportation so they can actually get to their appointments, helping them find discounted Medicare savings programs so they can afford their medications or maybe increase their disposable income. Housing providers care because we want to keep them in their home.
Okay, good answers. We're going to return now to the two people here in the middle with this next question from Melissa and Madeline. Kettering's Years Ahead Health Center in Centerville. This is going to get to the geography thing I alluded to earlier. This organization serves more affluent seniors, while St. Mary's affordable apartment communities serve low-income seniors. So, Melissa, how do social determinants of health vary with income?
So I just want to say Years Ahead, although we are centered in Centerville, which tends to be a more affluent area, we do have patients from all economic backgrounds. So I would say proportionately, probably we have seniors that are more well-to-do. But, we do see it all. And so social determinants of health are basically completely dependent on socioeconomic status because, and it can have a multi-generational effect. So if somebody's born into a low socioeconomic status, maybe they have parents who haven't even graduated from high school, parents who smoke, who maybe don't exercise, who are just trying to get by, maybe working 3 jobs. So it starts there, and they learn these behaviors, and maybe they pick up smoking too, and then they don't graduate from high school, and everybody's, even from cooking habits to activity habits. So then it just is a self-perpetuating issue. So if I think in terms of at a larger policy level, we can look at the person as a whole instead of just individual factors, especially like right now. I mean, it's just there's this hyper focus on access to healthcare, which is so important, but the whole picture is equally important. So, I mean, I think an organization like St. Mary's is amazing, especially because they have people who can help low-income seniors access all these available programs, but some of our poorer patients, they don't know about them, they don't know how to access them, and we need that extra person in there that can help provide that access.
That knowledge is key. Natalie, what's your take on this?
I agree. Social determinants of health are spread throughout all of our senior population. Our number one barrier, and obviously it does affect affluent seniors as well, but is transportation. Most seniors have driven. We get to a point where we can't drive anymore. Well, there's some exciting innovations in Uber and Lyft where seniors can still get the transportation they need, or private pay. Maybe they have a stronger social support network that can take them to doctor's appointments. Well, transportation for a low-income senior a lot of times results in what public transportation looks like. We can all imagine that public transportation is pretty difficult to navigate. So you throw in slippery sidewalks, possibly a mobility device, the fear of potentially getting robbed, and it can make just a regular outing a pretty stressful situation. Having the income to try to coordinate things becomes a challenge as well. Obviously, access to health. Food is medicine. We've all heard that. Again, if you have to choose between prescriptions, transportation, and whether or not you're going to eat, I don't know about you, but Maslow's hierarchy of needs says I'm going to probably eat and take the blood pressure medicine on and off, or postpone that. So having the means to be able to make those choices without having to make a sacrifice does become a little bit difficult. There's a lot of innovations. I mean, the telehealth piece, for example. If transportation's a barrier, there's telehealth. If the residents have Wi-Fi, or a smart device, or a computer where they can actually access those things. So even some of the potential solutions can be a barrier for somebody that doesn't have the funds to be able to afford them.
And I think we talked about this, I think, on the radio show at one point. Geography does matter to a point, at least when you look at the big numbers. But as I think we said, if somebody moves out of one neighborhood into a St. Mary's development community, they may be leaving behind a network of people who would act as healthcare advocates or healthcare warriors, as we've talked about in our radio program before. Someone who can be at that doctor's visit and help that person get through and get some of the relevant information. So your address matters, but it doesn't always matter, when looking at some of these differences. All right, to Maddie now. What are some examples of how social determinants of health can interact with each other to create a downward spiral for a senior?
Okay. I think the example I'm going to give you is one that many of you will have seen in your own lives. So Mary's husband died a few years ago. He took care of all the finances. And now she has a lot of worry about money because it isn't something she did her whole life in the family. And she also has no one to talk to about her worries, who would just have that soothing, don't worry, it's going to be fine. She doesn't want to burden her children who don't live right there. So she takes all this inside, and it's a really hot summer. She doesn't use any air conditioning because she's worried about money. And this, exactly like you were saying, there's food, there's prescriptions, there's rent. And so she doesn't use anything that she thinks is not absolutely critical. She also loses her appetite from poor sleep habits and a lot of worry. So she's not really eating the kind of healthy diet that she needs to. Well, she has asthma that had been very well controlled, but now with the real heat, which is a trigger for asthma, as well as the lack of really a healthy diet, she's getting asthma exacerbations, and she ends up in the emergency department for that. Something that's very avoidable and very costly. And this is just one. You can, in your own minds, I think of several examples. People who have some underlying condition, but when they're not taking care of really being in a healthy living situation, and lifestyle and connectedness and support, how that can really turn into something pretty serious.
And you could see that snowball. You could definitely see how those things would connect. And, you know, Melissa, you faced this, like I referred to earlier in a doctor's visit. Somebody shows up in front of you, and they've got all this backlog, this history of things, and you have to sort of unbundle all of that,
Right.
you know, and try to still be of some service to them. All right, here's the next question. This is also for Melissa. Transitions to new housing can be stressful. Seniors may need to move from a home to an apartment or independent living to assisted living. What are some of the things families should consider when helping a loved one make a housing transition?
So one of the things I see very often is that everybody wants to delay making plans for when they may need to move. So I try to encourage patients, when they're still healthy, to plan ahead instead of planning in a crisis when it's so much more difficult. So, and there's a lot of things to consider. I mean, obviously cost is huge. Some of these retirement communities are very expensive. So cost, I think proximity to loved ones, to friends, to healthcare providers. So the location is very important, especially because, as we were discussing, transportation can be such an issue. So the location, and then just accessibility. I mean, and many retirement communities are already like ADA approved. They maybe have grab bars. They are a single level. But if the income is such that a person cannot live in a retirement community, then the family needs to be looking at a place that is going to be conducive to an aging person who maybe mobility is affected. But again, I mean, the primary point I'd like to make is make plans before there's a crisis.
You should have been with us 9 years ago. This is why we cranked this whole thing up. I mean, we've been talking about that same thing. People kept saying, well, why do you want to talk about all that dirgy stuff? You know, that was the word that we kept hearing, all that dirgy, depressing stuff. Because someone's going to talk about it sooner or later. You know, families have to deal with these things. And our contention was, in the whole talk radio realm, you had plenty of news and politics and sports and garden shows and all this other. We said, why not talk about the things that people talk about when they're past the small talk? You know, after you talk about the weather and all that chit-chat and so forth, what are people really going through? And they're going through a lot of this stuff, too.
Right.
These transitional issues. All right, it's time to stop down. I think they're doing great so far. Do you? Yeah? Yeah? We haven't had a single gotcha moment. You know, we don't have any Fox News or CNN back there to plaster one of these people across the screen. We're going to stop down and ask another question of you audience members. And this is another one, another area that we talk about all the time on the radio show. Gloria, take it away.
That's true, Bob, we do. It's part of the discussions we have about caregiving and relationship. So today, using our polling software once again, we need you to respond in text to the following question. How much time do you personally spend, note the personal part of the question, we're not talking about your job, how much time do you personally spend caring for a senior family member or friend? Once again, how much time do you personally spend taking care of a senior family member or friend? Bob, I might need your help. Those numbers look a little smaller this time.
It's about 42% on up to 10 hours a week. 10 to 20 hours a week, it is about 8%. More than 20 is 4%. Those people certainly have their hands full. And not at all, what is that, 47% over there? So let me just tell you, all the 47%, it's coming. It's coming. If you're not dealing with it today, you'll be dealing with it before long. At some level, you know, whether it's 10, 20, you know, people have, one of the things we talk about, and it's kind of a touchy subject, but we've come to accept in our culture that we're going to have two-income households all the time. This is not the way it always was. You know, years ago, 50, 60 years ago, the economy obviously dictates some things in terms of what people need to make ends meet. But one of the things we always talk about here is, are people planning to care for their seniors? Planning, not just what house I'm going to live in, what school I'll send my kids to, but will we be able to stop down and have somebody not work as much to be able to care for someone else? So it's kind of a social question. Maybe for some people it's a moral question, but those are interesting results. And like I said, some people really have their hands full here, but it looks like a great many people are at least providing some care for a senior family member or a friend. Okay, we'll continue now with our panel. Maddie and Amy, you saw the results of our last question. Obviously, part of caring for seniors can include providing companionship, but not every senior is fortunate enough to have regular companionship. Can you discuss how common social isolation is among seniors and what problems it can cause? Either one.
So I would say as we talk about social isolation, oftentimes it gets associated with, do people have someone to be with, or are they lonely? And as we look at it, it is that, but it's also a little more than that. It's about the person having a sense of belonging and a sense of purpose. And do people, as they age, still maintain that? It's an American culture where we find a lot of our purpose and our belonging from work, from parenting, from who we talk to on the soccer field or at the PTA meeting. And as we age, we slowly lose pieces of that. And oftentimes with retirement, you lose a big piece of that. Now, my father retired a few years ago. He's found a lot of belonging and purpose on the golf course, and so that is great for him, and we are very thankful.
He feels at home.
But I think back, when I was in high school and college, I worked at a Hallmark store in Springfield, Ohio, and there was a little retirement community nearby, and they brought a van every couple days to the Hallmark store, so to the whole shopping center, so that the residents could come and shop. And every time the van came, this woman named Lillian was there. And she had her little notebook piece of paper, and she had this whole list. And on this list were all the other individuals at the retirement home who weren't able to take the van and get up to the Hallmark store. And she knew that there was a granddaughter having her first communion, or one of the daughters was becoming a grandma for the first time, or it was, somebody's birthday or a 50th wedding anniversary. And she would come and spend so long in the store carefully picking out each card. And for some people, she had the money tucked away, and she would come up and have all these individual transactions, and she would tell us about what she was buying the cards for, and that was Lillian's purpose. Lillian's purpose was to come in and buy all those cards so she could take them back to the other residents so they could connect with those that they loved. And it was a few years in, and Lillian wasn't coming. And so we asked one of the other residents, where's Lillian? We all knew Lillian. Where's Lillian? The other residents were probably like, why don't they ask about us? Why do they keep asking about Lillian? And it ended up that Lillian was ill. And she had been diagnosed with cancer, and it was a very aggressive form of cancer, and she was going through some significant treatment. And a few months later, it was right around Christmas, she was back. And she said, she was like, that whole time I was going through treatment, I knew I had to get better because nobody was buying them their cards. I couldn't trust those other ladies who said they were going to do my job. I had to get back because so-and-so, she only gives me $1 for her cards, but I always buy her the $3 ones. And so, she forgets one granddaughter's birthday, and I knew that if I wasn't back, that granddaughter wasn't going to have a card. And that was Lillian's purpose. It seems so simple, buying greeting cards. But it was so powerful for Lillian. And so as we think about having activities or doing things within senior housing or senior groups, we have to remember also, what role do they play in that? Are they the person who passes out the bingo cards? Are they the person who leads the knitting class? Are they the person who chooses what the movie of the week is? All of those help give purpose and belonging, and that is so key to helping with social isolation.
Yeah, and there are a lot of ways to overcome that, to give people some purpose or engagement. Maddie, what are some other ways?
social isolation is a huge problem, in case you're wondering about that. Many, many millions of seniors are affected by it, and it does have big impacts on sleep and brain aging. You know, it has physical impacts. But Amy, you're making me think of someone, so I have to share. So Aunt Alice, who actually lives in Ohio, in Cleveland, suffered from a break with schizophrenia when she had 2 young children, and spent quite a significant part of her life and theirs in homelessness in a time when there was really no good medication. Aunt Alice now lives in a senior, affordable, well, actually public housing for persons with disabilities and seniors in Cleveland. And she is going to be celebrating her 90th birthday. And that is extremely unusual for someone with schizophrenia who experienced homelessness over a lot of their life. So I attribute that to Aunt Alice is just like your example here. She had a purpose in that building. She played the handbells at church, but she also was the person in the building. She had a car, and she took everyone to get their prescriptions, still does actually, to get their prescriptions or groceries at Aldi's where they can afford it. And she has such a serious purpose in life. And you just made me think of that. Like, why is she going to celebrate her 90th birthday? The odds are she wouldn't have made it beyond 55. So there you go.
Those are some great stories. You know, I know people talk about planning for retirement and so forth, but that's a dirty word on our show. We don't like the idea of retiring from anything. So we do it here professionally in our country. We have Medicare kick in, 65 and so forth. But the idea of people still doing things. I just learned recently about, I play softball with these guys in a 50 and over league, and somebody was telling me about a guy who was still pitching softball at 94 years old. So, got to keep going, you know? So those are some great stories. All right, this next question is for Melissa. We'll swing it back over to you. Kettering's Years Ahead Health Center has a significant focus on education programs. Why is ongoing education so important for seniors, and what types of programs do you think are most important?
So Years Ahead is great. We have a large conference room, and we have educational programs really throughout the day, offered at lunchtime often, in the evenings. And the nice thing about them is they're almost always free. They range from anything like financial planning to processing grief. There's focused ones on health, diabetes, or COPD, smoking cessation. So they run the gamut. There's also some support groups there. And the reason we feel like that's so important is largely what we've been talking about, the social isolation problem and just keeping people active. After retirement, people can tend to stagnate if they don't either have a purpose or they don't have a plan. And social isolation and just lack of activity become a problem. So by trying to engage our community, and luckily where we're located, there's a lot of retirement communities very, very close to us. Many of our patients can even walk, which is nice. And so then they can access these programs. And in terms of, you know, which program is the most important, I mean, that's so individual. It's like asking a scientist, is physics or chemistry more important? So it kind of just depends on the individual. But just maintaining some kind of social engagement and always actively trying to learn helps preserve mental, preserve our mental functioning, prevent cognitive decline, prevent depression, and social isolation. So
we've talked a lot about that, the idea of purpose and engagement, even in the stories that you mentioned there, or education. Anything is better than the TV.
Yes.
You know, one of the central thesis points we used to make when we first started the show was that we spend an extraordinary amount of time in this culture on the first 20 years of our life, becoming our first this, our first that, and so forth, all these celebrations as you become an adult. And too many people phone in the last 20 years of their lives because they sit in front of the boob tube. You know, so anything people can be doing to stay engaged makes sense. And those programs sound like a really good way to do that. All right, we're going to shift gears now and get into another topic within this whole social determinants of health conversation. This is for Maddie and Madeline. What is medication reconciliation, and how can it impact health and social risk? Let's start with you, Madeline.
So it's really complicated, right? It sounds really complicated, at least. It's an accurate list of medications. I'll tell you a story to make it a little bit easier to understand, because you guys deal with medication reconciliation all the time and just don't realize it. So you have seniors on medications. Maybe they go to a hospital. They're given new medications at the hospital. After that, they're discharged. They go to a rehab facility. Well, only the attending physician can prescribe medications. You can't take the other stuff that you didn't prescribe. So the rehab facility then gives them new medications. So then they're discharged, and they're told to come home, obviously, and follow up. What do they say? Follow up with your primary care physician. These discharges always seem to happen at 3 o'clock on a Friday, of course. So by the time they come into our office, they aren't able to get in until next week. They have absolutely no idea what they're supposed to be taking. So I visited with a resident who came in. We were able to get her an appointment for her primary care physician, and she had a bag of medications, like literally a plastic bag full of medications. She had her medications, including her insulin, from before she went to the ER. The ER prescribed a bunch of different medications, including insulin, and then she was discharged to a rehab facility where they prescribed a bunch of medications, including insulin. And now she's at home waiting to see her primary care physician and has absolutely no idea what she's supposed to be taking. With insulin, obviously, that could be life-threatening. If she just took one of everything in that bag, it could pose a huge, serious health risk for her. So, I mean, we were able to get her medication reconciliated. Obviously, we called the rehab facility. We had them fax us over a current copy of what medication she was supposed to be taking. So then she could pick out exactly what she was supposed to be taking. She can bring that list to the appointment that she had next week with the primary care physician. We were also able to contact a home health care agency to go ahead and get them in place for some physical therapy and to make sure that there's medication compliance. Because a lot of physicians will say, well, you weren't taking your medicine. Had we not connected her to that, that's probably good she wasn't taking her medicine, because she would have had no idea what to take in the first place. We were also able to get her connected to a home-delivered pharmacy that could bubble pack her medications to make it a little bit easier, because opening the pill packs or opening the prescription bottles was a little bit difficult for her in some cases. And they always include an itemized list of the medications, so that if the physician reported a new change, they would notify the pharmacy and it would be delivered directly to her home. So it sounds like a really complicated word, but it's pretty much just a list of medications so that our seniors know what they're taking.
Yeah, and keeping track of all of
And
that.
keeping
Right,
track.
Yeah.
Absolutely.
Maddie.
Yeah, so it's really an important issue. This is not uncommon, and particularly with people who have limitations with health literacy, but also we all have cognitive decline as we age. That's a normal part of aging. And so getting home and having like a medicine cabinet full of medicines and you actually forget what they're for is a very, very common situation. And it has real health outcome, costs associated with it. It's a huge cause of adverse drug events, which can be life-threatening and are definitely costly. Readmissions into the hospital. In post-acute care, so someone going to rehab, a lot of them come in with delirium from all these, from whatever the procedure was, all these medications. There's no one who reconciles it, and that poses a huge risk for falls, which we all know how that goes down when you're elderly. So it's a huge issue. It has incredible healthcare costs associated with it, and it's not a hard thing to help people with.
Yeah.
You can see how interconnected so much of this is, too. We've talked about how these things kind of weave together, and you have to really take them apart to look at what people truly need. And our next question here, and this is for Amy and for Natalie. In what ways can senior housing serve as a foundation for healthcare? And does housing design and site selection impact social determinants of health? Can you give some examples?
I can take that. Since we're a housing provider, it works out great. I would like to note that senior and just regular senior housing and affordable housing, having modifications, obviously accessibility is a way that senior housing can serve as, a way for healthcare. Grab bars, wider hallways and doorways, no step entries. I mean, like you were saying earlier, we always tell people, start when you're able to remodel your house, put in the lever door handles, those types of things, because as you age, it'll be a lot easier for you. It helps prevent falls and allows people to age, obviously, in place. Our senior housing, that's one of the things we're the most proud of, because people can come in at 55, and then as your needs change, one of my favorite stories is, if you're renting, you go to your, if you don't have those modifications, you go to your landlord and you ask for a reasonable accommodations to have these things added. Okay, so you have a senior that's 55 years old, they don't need it. Maybe at 65, they don't need it, but on bad days, they do use that grab bar. We all have dignity. How many people are gonna come to their landlord and say, would you install this grab bar just for bad days? Probably not. They're gonna wait until they absolutely can't stand it any longer, or heaven forbid that they have a fall. I think it's also important to note our senior housing, one of the, yes, it's affordable for low-income seniors, but there's a pretty good chance that several of us in this room are going to be low-income seniors. We house waitresses, people that have devoted their lives to charity and service work. We have teachers. We have a whole veteran campus. So it's not just like, oh, the low-income senior housing. This is us, guys. Our retirement, there's some of us that are going to end up exactly in that situation. So as a caveat to healthcare and site selection, obviously the grab bars and those types of things are important, but proximity to things like grocery stores, hospitals, transportation, a bus stop, those are going to be just as big as the accessibility piece of it. Service coordinators, obviously, we help connect them the best way we can. With transportation being a big barrier, there are some exciting things like I mentioned before. Some people had said that they were interested in learning about resources. So GoGo Grandparent is actually a service where the seniors themselves call a telephone number and they schedule transportation. The person on the other end schedules an Uber or Lyft ride, tells the senior, okay, you're gonna be looking for a brown Honda. They go out there, look for the brown Honda, and they call the number when they're ready to leave. It's using the technology that we're using, only they can just call a number. So if they don't have a smart device, or the screen's too small, or they don't know how to operate it, it's a resource that they can use. So sometimes it's us scheduling, project mobility, but sometimes it's also giving them resources that any seniors can use.
And that was called Go-Go Grandparent?
Go-Go Grandparent.
I'm glad it didn't have to do with dancing. So, Amy, would you like to add to that?
So I'd say the most basic part of housing is that there just has to be units available. So we have individuals who we are providing coverage for who are in nursing home facilities, and they want to transition back into community. They do not have a medical need to remain within the nursing facility, but because the nursing facility cannot release a person to homelessness, they can't leave the nursing facility because there are no units available. In some cases, these were individuals who prior to entering the facility may have owned a home and had paid it off and it was free and clear for the last 25 years. They owned it, but now it's only valued at $10,000. Or it went into foreclosure, in tax foreclosure or what have you. And so they don't have that place to go back to go into a new unit. They don't have the money to go into that unit. So finding those affordable senior units is critical, and there is not enough of them out there. The other part is that a person, like we talked about social isolation, having purpose, belonging, being within what you consider your community is very important. And so if you have lived your whole life in a 2,500 person town, being able to go at least somewhere back into that community or near that community is very important, because oftentimes the only option is 70 miles away. And you're going to a big city, you're going to Columbus all of a sudden. You're from a town that had one stoplight, and now you're in the middle of downtown Columbus. That is a shock, and it is so difficult for people to kind of comprehend what their life will be like there. So having the right units, that's so important. That's why we turn to great developers like St. Mary, who think about those little pieces and parts. But whatever we can do at the policy, at the funding, and at the development level to include more of those units into our communities and more of those units into a diverse geography across the state is very beneficial to those that we serve.
Absolutely, absolutely. We've talked about that on the show, that the evergreen business, there will always be a need. And if we can only build places faster that were updated and had all of these services and amenities, it would be a wonderful thing. All right, it is time for another question to our audience today. Gloria, I'd like you to make this one really, really hard.
Okay, studio audience. You heard him. We're going to make this one tough. What do you think is the biggest negative social determinant of health in our area for seniors?
What do you think is the biggest negative social determinant of health for seniors in our area? Downsizing and navigating housing transitions, about 13% of you. Accessing and navigating healthcare, 15%. Understanding benefits like Medicare and program eligibility, 12%. Here's the big one, maintaining social connections and meaningful relationships, 27%. Figuring out how to manage expenses after retirement, 22%. And what's that last one? Navigating transportation as you age, 11%. So a lot of challenges. Good information, good information. Okay, panel, we're in the bonus round. You're all doing great. Nobody's cracked under the pressure yet, but there's still time. With that said, this next question is for Amy. How are some examples of technology being used to address social determinants of health with seniors?
So this is a very interesting area because there is a lot of technology out there, and even as a person who's kind of in that millennial age range, some of it even scares me. But there is all kinds of technology. So they talked about medication. There are actually medication dispensing systems that you can insert the blister pack into, and it's weighted. It can tell a person if that slot was opened for the day, if all of the pills were removed, what time the pills were removed, if an extra slot was opened during the day, and it all is being fed to someone on an app. It could be a caregiver, it could be a loved one, it could be a doctor, and they can receive all that information about the medication adherence. And if the person forgets to take the medicine, you can trigger an alarm to remind them to go take the medicine. So when we talk about medication adherence, there's lots there. There's a lot of motion observation, everything from your security system within your house, being able to tell if a person has entered certain rooms during the day. There's also simple things that are very agreeable to people. If a person is wearing a Fitbit, most people are pretty comfortable with wearing some kind of like activity tracking device. You can say to your loved one, you can say, you know what, I work at my desk all day and I really haven't been getting enough steps. Hey mom, hey grandma, hey whoever, will you help me out? Let's have a fitness challenge, and we'll pair up, and we'll see who takes more steps each day. And you can encourage me. Well, they're going to see if you're really moving or if you're being lazy at your desk all day, but you can also see how many steps they're taking. When are they taking those steps? When are they getting out of bed? You have both agreed to share that information with each other. Within communities, you know, everybody can, just like you would at work, everybody can join a challenge together and they can see that information about each other, and maybe someone's the encourager who goes and knocks on their neighbors' doors and say, hey, let's go for a walk. Really, all of that's out there. All of it's free with the Fitbit technology, and so you can easily do this today. There's also things like Alexa or, you know, your Echo or what have you. I will say I personally think this is where it enters the creepy stage, but you have to think about that it's also, what would you want someone to do to you? Would you want someone listening in or, you know, kind of telling you what to do? How would you like people communicating with you and using those? But Alexa, great for individuals who need verbal triggers and verbal reminders throughout the day. FaceTime, Skype, really easy to use. So a lot of times when I talk to individuals, though, they say, oh, but it's so confusing and it's so hard. And I kind of turn and I look to them and I say, like, my mom is someone who went from not having a phone in her home to today using a smartphone. Like, she made it through rotary dial, touch tone, cordless phones. I think we can make it through smartphones. And so part of it, though, is about taking the time to explain the technology, to not saying, oh, this is so hard, like, you really have to pay attention, like, I don't know if you're going to get this. Like, let's trust. People are smart, and if they want to do something, if you explain to them the why, if you say, hey, Mom, the grandkids would really like to see your face. They want to connect with you, and there's this great app, and it's called FaceTime, and we can connect it, and you would be able to actually see the grandkids every day. A lot of people would do anything to see their grandkids. So great motivator. But then you can also say to the grandkids, like, have grandma show you that new stove she just got. And she takes it into the kitchen and you get to see what's going on in the kitchen. And you get to see, like, all different kinds of things. Like, show us your flowers. And then you see that maybe she didn't plant the flowers this year. These are great ways that you can engage, and technology that's already there, that's very easily accessible, and that there are a lot of programs out there that even within affordable living communities that you can get free Wi-Fi connections. There are different groups that will help sponsor. Some of the health plans even give free Apple Watches or give free iPads and things like that. So there's ways to be able to bring this connectivity in regardless, but we have to teach people that it's all accessible and that they are super smart people and they know they have the tools and the ability to use these.
Does this mean I have to get rid of the flip phone?
No, you don't have to get rid of your flip phone. My husband's hoping to go back to a flip phone.
They were so simple. You just
I know.
All right. Madeline, you had some research done at St. Mary that talked about technology use. Can you share some of that?
Yeah, absolutely. If CareSource wants to give away Apple Watches, our residents would be more than happy to be recipients of that. I just want to throw that out there.
I will say that's United Healthcare. They do that. So.
So we knew that there was a lot of technology out there. We'd heard about some really exciting things that people were doing. AARP actually has a really exciting program where they partner with affordable housing providers. So we looked out there to see what kind of research we could find on seniors and technology. Is there a good way to ease them in? Is there something that's not quite as costly? What do seniors want? What are they comfortable using? And we realized that there was a lot of research out there, but it was all done on affluent seniors. Okay, so we partnered with Link Age and our fabulous Delmar Fellow from the Dayton Foundation, and we were able to do some surveys with the residents to talk about, what do you have, what do you use, what are you interested in, and how you want to learn. So what we found is that 51% of our residents actually did own a smartphone, and most shared they were interested in learning and using technology. So when given the opportunity to complete the survey, they could either do it electronically on a computer or do it on paper. And 70% of them did it on paper. So although they were interested, they completed the survey on paper. Let's go back here. So with that being said, a good majority of our seniors also reported that they did have some kind of healthcare technology that they were given, whether it be a blood pressure machine, insulin. Some have even had some really complicated healthcare devices that were technology-based that we hadn't even heard of, that they had explained to us when we were doing the surveys. Well, that's kind of crazy, that they're not really that comfortable with the technology, but they're using these things that were issued by their doctor. So we were a little intrigued by that piece of it. We also found that one of the greatest barriers that our residents reported that they had with technology was that they weren't able to afford it. Well, that makes sense. We're surveying the affordable housing, lower income population, which that includes their devices. They couldn't afford the devices or the internet. We also found that 91% of our residents reported that they lived alone. But when we asked them how they wanted to learn about technology, granted the kids could tell them how to use it, they said they wanted to learn it among their peers. So when we think about them living alone, the AARP program that they have reported that when they introduced technology to the residents, that 70% reported that they made a new friend in their community. Because they had something to talk about. They could say, hey, are you having trouble with this device? Or here's where I'm at. So they reported that they wanted to learn about new technology amongst their peers. I mean, for us, this is really exciting because it indicates that senior housing communities would be a great place to offer technology education for our residents so that they're not left behind. I mean, even if it's just Alexa, because then you don't have to worry about having a smaller device where it might be hard to see, dexterity issues, but you can just ask Alexa. You can actually partner in some cases with a community hub where you can say, hey Alexa, what time's the congregate meal going on in our building? Or what's for lunch today? Or what time's bingo in the community room? Those types of questions. So it does also help with the social isolation if they can access the technology in a way that they're comfortable with.
That one's coming right through.
It's a train.
Everybody duck. Good answers, I appreciate that. All right, Maddie, this next one is for you. Social determinants of health cover so many different areas. We've talked about a lot of them here this morning. The issues are interconnected and they are vast, very complicated sometimes. What are some examples of partnerships between organizations that have helped solve problems that no one organization could solve?
So in Baltimore, we have 5 senior service kind of hubs. And in these hubs, different community service providers have come together to meet the needs of seniors typically living in their own homes, very low-income areas. And this includes Meals on Wheels, so helping with, and referrals to the hubs from healthcare, hospitals or health plans. So Meals on Wheels, and then another program called Capable. Capable is a program that was birthed in Baltimore, but is now in Ohio, actually, in Cincinnati, and lots of places in the country. And Capable is a program that when a senior who's socially isolated leaves the hospital, they can get this home visit from a nurse, an occupational therapist, and a handyman who all come together, and it's very well defined. And the person gets to say what's most important to them in life. What is their purpose? And if it's getting to church, the handyman will make sure that they put in whatever's necessary to be able to get in and out or bathe independently. I mean, this is what seniors will say. Nobody's telling them what's important. They're deciding that themselves. The occupational therapist helps with any mobility issues, and the nurse handles medication reconciliation. And so in these hubs, we're really addressing a bunch of social risks, but all coming together on one person who has needs, and it's all coordinated that way. So that's my favorite.
Thanks. Amy, did you want to weigh in on that one too?
So one example that I'll give is food delivery. So food delivery is a common methodology that middle and upper income individuals use today of either ordering your food online and going and picking it up, or ordering your food online and having the grocery store deliver it to you. But currently that technology is not accessible for individuals who are using food stamps. Currently, through the USDA, they are trying to create a system that would allow people to use food stamps online, but that technology has not been completely tested yet. And so the grocery stores, though, saw that there was an opportunity to bridge this gap. And so Walmart created a platform that they are currently piloting across the country where they said, if you want to use food stamps, you can go and order your groceries online. We'll suspend the transaction because you tell us you're going to use food stamps. And then when you get here, you can actually show your card and we'll swipe it and you can then pay for your groceries. And if you have to pay cash for part of it, you can, or other credit card, you can pay it at the place. But then they said, well, how are the individuals going to get to the grocery? How are they actually going to get there? Because it's not going to really work with public transportation. And so Lyft stood up and they said, we'll figure this out. But the thing is, if you've used Lyft or Uber, you know that the rides are usually only one way. It's you go somewhere, you stop, and then maybe you'll call for the same ride to come back. Lyft said, we'll make round trip rides for these groceries. And so we said, perfect, all right. So now we got Walmart, they're gonna do their part, Lyft's gonna do their part. They said, well, Lyft's kind of expensive, and so who's gonna pay for this? And so that's where insurance companies, CareSource in some of these markets has stepped up and said, we'll pay for the rides. And so for individuals who, in the senior population, who have certain chronic conditions or who need very specialized diets, we are actually paying for 2 round-trip rides a month in order for the individuals to get to the grocery store. They pick up their groceries just like they would, and then they can come home. Then the care managers or whomever they're working with can also work to make sure that wherever they're living, that maybe somebody's there to help them carry in their groceries, or they have, they can place a wagon out by the road or something. So they help them figure out how they're going to get those groceries into their home. So this is launched in Cincinnati. There's currently a pilot there. There's hoping in this area to also expand it to Xenia. That's one of the other Walmarts that is participating. So we're seeing this. Walmart is hoping to take it to the next level. Lyft's hoping to take it to the next level. So we hope to see things like this becoming more and more prevalent within our communities.
Those are some great examples of collaboration. I mean, really people thinking, trying to solve those problems. That's good to hear. Okay, audience, we are down to our final formal panel question. We are now going to test each of these ladies' capacity to see the future. Panel, and we'll start with you, Melissa. If you had to make one prediction for the future of seniors, housing, technology, and healthcare, that's not complicated, is it? What would your prediction be?
So I do think that's a difficult question. However, I do see the future moving away from nursing homes. I mean, obviously there will always be a need for people who are very, very ill. But I think there's going to be so much more of a focus of trying to keep seniors in their own homes for as long as possible. And so I think using collaborative efforts, like Amy was just talking about, from multiple different sectors is going to be the answer. And I think so, just finding a way to synthesize all that to keep seniors in their homes. And I really see that that's kind of the direction we're moving. And that's, I think, what most seniors want too. People don't want to be displaced.
Over 90% of people want to stay in their homes, right? Right. I envision the day when everyone has an Amazon portal instead of a garage, and their
That's
little
right.
drone will just fly down and say, here's your meal for today. Anybody who's really an entrepreneur wants to take that up, feel free. Natalie, your prediction.
I do agree with you that people are going to want to stay in their homes. And honestly, the ugly truth is, as taxpayers, we can't afford for everybody to go into a nursing home. Our economy pays a lot of money to put people in nursing homes, and they don't want to go. Right. So from a senior housing standpoint, I mean, obviously I think service coordination's the answer, but I might be a little biased there. I think that technology really has the ability to make some strides. The healthcare industry is going to have to change the way they're doing things. They're just going to have to. As the senior population explodes and the influx of people in the emergency room, I mean, you guys are going to feel it. You're going to wait to see your primary care physician. You're going to wait to get in to see a specialist, because obviously somebody with multiple chronic conditions is going to be able to get in a little bit quicker than you are if you're just there for a routine checkup. But we've seen some innovations. I mean, Google is actually partnered with housing. We actually have some Google housing coming in Dayton for rehab and substance abuse. They've actually partnered to do that. Amazon's doing some really exciting things with home-delivered pharmacy. They're even offering telemedicine to their employees. So I think it really gives the opportunity to help bridge some of the social connectiveness, healthcare and transportation barriers. Everybody's going to have to work together with the partnerships, like you said, because if we don't, we're going to feel it one way or another.
Absolutely. Maddie?
So I'm always the optimist, but I'm listening to what you said, and you're not bringing out my optimism. There's one worry I have, Natalie. I do think that things are going to really get a lot better for people of means. I worry a whole lot about people who are poor or who have serious mental illness, have no one to help them. I think, and we already have a pretty big divide between people who have different vulnerabilities and how well they do in health, and those who, the zip code, going back to the zip code. So if you go back to different neighborhoods, you can have a 20-year difference in life expectancy. And I worry a whole lot that that's actually going to get worse unless we work together really in very creative partnerships to make sure that everyone has access to these great, new technological innovations.
And to add to that, one of the things we talked a lot about is the huge coming caregiver shortage. The Japanese have already felt this, and they've introduced a lot of robots, in their culture, different robots that do different kinds of functional things. Some are for companionship, some are for lifting people out of beds, some are for medication reminders and so forth. We have a serious caregiver shortage coming in our own population, and as we've often said in the program, it's not a career that pays a lot for people who are in that line of work. So there's a lot of turnover. It's been that case for a long time. So, but even the people who have caregivers are usually people who have some means to be able to pay for that. And if families don't care for their seniors and they can't afford caregivers, that's a massive problem societally going forward. All right, one more prediction from Amy.
So I think that we are creating the system that will take care of us when we are 80, 90 years old. And so if we think about if I think about in my situation, how my Generation Alpha kids will care for me, this is all going to be determined by the land use policies that we make today, by the social policies that we make today. These will all define what that environment looks like. If we stay on trend and on pace, my children, who are very young today, they will have to earn somewhere around $40 an hour. We even afford an apartment in Dayton, Ohio. They'll probably be looking at having to make $100 an hour to afford one in San Francisco if trends remain the same. The truth is, today we don't have enough housing units available to individuals, especially low-income individuals. We don't have the skilled trades. Even if we created some tax incentive or some huge federal bill to pay for trillions of dollars of housing to go in, we don't have the skilled trades to build it. So unless we make decisions today to fix those issues, we will have a much bigger problem on our hand, and part of that is about deciding social policy, such as growing up, I lived with my grandpa. My grandpa lived with us from the time I was 3 years old until I was 12, and multi-generational living was culturally part of our life. But we have social policy that does not allow for multicultural or multi-generational living. But we don't have enough housing units. This idea that a roof is only for one household, but a household, we can define it differently. We have to think of how we've constructed these ideas and maybe think a little bit differently, plan land a little bit differently, and consider what society prioritizes a little bit differently if we really want to have the best options, the best care, and the best life 50 years from now.
Thank you. Thank you very much. That concludes the formal questioning part that we had for everybody. We have just a tiny bit of time left for some questions from the audience. Now, there were cards on your table. If you had not already utilized them to submit a question, we'd love to have that research, even if we can't answer it in today's session. But prior to everyone being here, there were some questions asked in the last email, and we have one or two here that we can take a stab at with the panel.
Yeah, so one of them was, what are organizations right here in the Dayton area doing to help seniors with social detriments of health, specifically?
Don't be shy.
Well, Kettering Network is very active actually in trying to look at the whole person, and even from developing centers like Years Ahead that are focused on a senior population and providing these educational programs, things like that. But if you look at Grandview, they have, for instance, I can't remember what they call it, but it's almost like a farmer's market where people can access relatively cheaper produce and trying to improve, access to healthy foods. Kettering also has Good Neighbor House right close by, just down the street here, which is for people who have no health insurance, but they are employed, so they're the working poor, and it's staffed by volunteer physicians. So, I feel like Kettering is trying to reach out and solve some of these problems for our area.
Can I try to stab at that too? So you've heard a little about what service coordination is. If we could give everybody access to a service coordinator, that would be fantastic, right? That'd be really helpful. Well, there's no funding for that. We provide service coordination in some of the buildings without funding because it's part of our mission. But we're actually in the process of researching a statewide service coordination model, and we're not doing it alone. We've actually got probably 10 different other agencies, GraceWorks Lutheran, Episcopal Retirement Services, and many more that are invested to try to figure out a solution for this, whether it be insurance companies recognize that service coordinators and the work they're doing and how we're initially helping reduce their costs because we're keeping them out of the emergency room and helping them manage their chronic diseases. But it's not just about the work we do. We all partner because we realize that this could potentially be a solution. Every time our director of philanthropy goes out and talks about what we do, even if it's at the Oakwood Rotary Club, somebody says, how do I get service coordination for my family? And we laugh, and of course we're like, you can call me, but it's a huge need, and a statewide service coordination model would, I think, help that.
Okay, here's another good one, I think. How are businesses planning to accommodate aging but still productive workers in the multi-generational workforce? Are they offering flexible schedules, support for mentor relationships, or phased retirement?
So I think this is a very interesting question. I think that the millennial and the Generation Z are really pushing the envelope on flexible work schedules, on longer maternity leaves, on all kinds of live-work balance kind of things. When I think about my parents' generation, that would be the number one thing they told me not to do, is go sit in your seat for 8 hours a day, work hard, stay at the same company for 30 years, It was that really great work ethic that was, deeply rooted. And so I think, though, now, that as they age, they're saying, how do I start stepping away? How do I start using this flexibility? How do I start looking at this construction of work a little bit differently? And as we look at individuals in the highest levels, in the highest positions within the organizations who are aging, they have to set the example. They have to be the ones who say, it's okay to take your 2 weeks vacation. It's okay to leave at 4:30 to make sure that, your mom makes it down to her dinner at the senior living facility. They have to set the tone so that the workers who are answering the phones, the workers who are at every level of the organization see that it is okay to prioritize and to make those accommodations in that kind of baby boomer Generation X populations.
Okay, and here's a good one. I think that this might be interesting for some to realize. What is the current status or need for social housing for aging here in Dayton? And maybe particularly for those that are of low income? And where are we headed for that in the future?
Housekeeping. Number one, housekeeping. Caregiver shortage, like we were talking earlier, it's very difficult. The way that it's set up right now is if you're a person of lower income, you have to meet certain criteria to be eligible for a home health aide to come into your home. That means higher increase of needs, or ADLs, for the healthcare, 27% of the healthcare population that was up there, higher needs in order to qualify for that. Well, what if you don't have those higher needs yet? But pushing a vacuum is difficult. Carrying the trash out is hard. Because of the shortage, we're putting our seniors almost at risk, because if that trash is too heavy, maybe you'll take it out in small segments, or maybe you'll leave it there until somebody does come to visit you to take it out. Well, that's a health hazard. It's also a fall hazard. If we could get the housekeeping in early, I really think that we'd be able to prevent a lot of the problems that we have. But there's a huge shortage in caregivers.
These are all great questions. And again, I'd like you to encourage everyone here. If you don't want to write it on a card right now, that's fine. Any of these panelists, I'm sure, are happy to receive a question via email, right? Mm-hmm. Mm-hmm. And if you have a particular question that you don't address to one of the panelists, Madeline can receive all the other questions pretty much about the event and about a lot of the content here. Because obviously she's never short for words. And
It's true.
I had to bust somebody up here. Let's have a hand for everybody. Did a great job.
I paid her to say that.
We're chock full of information. And I want to just say I appreciate the opportunity with Gloria here to come again. We don't want to make too many shameless plugs, but if you have a chance to check our show out, please, Saturday mornings at 9 o'clock at 95.7 FM. That's WHIO Radio, 95.7 at Saturday at 9 o'clock. You can also visit our website for any of our past podcasts. We've covered an awful lot of the content here in some form or another at thereisasezonshow.com. And you'll find lots of good information out there. And it's a great thing to share with your family members and friends around the country. It's a great conversation starter. Thank you very much. Appreciate your attention.
Thanks to Bob and Gloria. And thanks again to all our sponsors who made this whole event possible. It's great to be with all of you. When we asked you for questions beforehand, the biggest question we got was about resources, different resources and tips, things that you could use kind of in your daily lives, in your work. So there's two things that we're going to do. First, we brought some of our resource guides that we create for our residents, and those are by the door, and they include different kind of categories and numbers, so feel free to take one of those with you. The other thing that St. Mary's is going to do is we plan to create an email newsletter where when we find new resources, we can get those out to you. And so we'll make sure that you know about that. But if you ever have a question about anything, you're looking for a research, whether personally or professionally, contact us. We'd be glad to put you in touch with our other partners. We work with over 100 local agencies to solve all of the issues and address the social determinants that you heard about today. So feel free to get in touch with us. And thank you again to our great panel. That's all we have today, so have a great morning.